the last lead.
Hi all, welcome back to Nursing Guru. Today we are going to take a class which is regarding the education technology and nursing education. So both are the same subject only, okay? Don't be confused with this one. So the name itself we are calling education technology, or it may be nursing education. Both are same subject. So this is one of the important subject in the BSc nursing. As you all know, already you have prepared for this tomorrow's examination. So here I am Swarnashri and this is Harshita ma'am. Today we are going to give a exam preparation class which is related to the subject. Okay, so let's start the class. So ma'am,
we will start with the unit wise revision. So later we will give the important questions which is completely related to this CET or educational technology or nursing education. These three names are same. Okay, don't get any confusions between these names. So let's start with the first unit, that is Introduction and Theoretical Foundation to Educational Technology. So in this unit, the main important thing is the definition of educational technology. The definition they'll ask, define educational technology. Then the aims of educational technology, it's very important. Scope, approaches, definition of educational technology. So there are three latest approaches is there, so that you should know what are those three approaches of educational technology. Approaches we can call, or as scope. So in that you already know that the first one is a transformational education, relationship based education, competency based education. So these three approaches or the scope of educational technology, it's very important. You should study this scope of education, definition, aims and approaches. Transformational education, relationship based, then competency based education. Next, the very important thing is philosophy. Okay, definitely they will ask this. Define philosophy, objectives of philosophy, then education and philosophy. What is education? Difference between education and philosophy. This is they are going to ask. Then comparison of educational philosophy, that is what I said, difference, or they will be asking what is the comparison between the education and the philosophy, so that you should know. Then philosophy in nursing education, what is the role of philosophy or objectives of philosophy in the nursing education or educational technology. This is also very important from the unit number 1, that is Introduction and Theoretical Foundation. So you have to learn this. Next, when it starts with a teaching learning process, so you should know what is teaching learning process. Okay, so what is teaching, what is learning, this you should know, how this whole process of teaching and learning goes, the relationship between the teacher and the learners, how this process will be built up, that is you have to study. Then nature and characteristics of teaching and learning process, this is also very important. Then the principles and barriers of teacher learning process or the teaching learning process you have to study. Then moreover in this you will be studying about the learning theories. You already studied this learning theories in the psychology first year itself, you have studied. So that same thing will be repeated in this unit, that you have to study theories of learning. It is very important question, like experimental learning, blended learning, then simulation based learning, scenario based learning. So all those theories of learning you should learn. Reflective learning, these are the important things which you have to study in the unit number 1. Once again I'll just give a quick review of unit number 1. So here you are going to study about the definition of educational technology, then aims or approaches and scope of educational technology, then philosophy, definition of philosophy, difference between education and philosophy, then philosophy in nursing education, this is also important. Then when it comes to teacher learning process, so in this teaching learning process definition you have to study, then the principles of this and barriers of teaching learning process. Then one more is learning theories, this is also very important, you should study this. Next, assessment and planning, second unit. So So the unit number 2, it is assessment and planning. So in this assessment and planning, about the teacher you are going to study. Okay, assessment of teacher. So what are the characteristics of good teacher, or the qualities of good teacher that you have to study? Then teaching style. There are varieties of categories or the styles of teaching that you should study. Then when it comes to the planning, so in that planning area you'll be studying about assessment of learners. So in that type of learner, motivational factors, like when they are learning, what are the factors will be affecting on their learning process, so that you should study. Then in this assessment and planning, the very important topic is curriculum. Curriculum, it's nothing but our syllabus. So you, in this unit you will be studying about the curriculum development, curriculum design. So what is curriculum, what is the planning of curriculum, how they are going to develop a curriculum in the universities or in the institutions. So that and all you will be studying in this. What are the barriers when they are
Planning this
developing a curriculum, so what they'll be facing. So everything you should study in this
See,
unit.
in this particular unit, madam told that curriculum planning, no? So, whatever the course it may be, it needs one plan, okay? So, we can't able to
Syllabus,
provide
nothing
you
but.
that you are admitted for the nursing, we are not having the knowledge of nursing, we are not yet prepared for what we want to give you, that doesn't work, okay? So, we have the syllabus. Again, when we are studying, by the time it is the annual based examinations were there, but now it has been, the curriculum has been updated towards the semester batch, okay? So, we have particular semester, this much of syllabus they have to study, this much of knowledge they have to gain in this particular 6 month or 3 months of duration. So that is how we have planned, no? So that is the curriculum planning, okay? So the entire process, how it will be taken place regarding the particular curriculum concept, you have to go through, okay? So we don't have a much time to explain each and everything, so we have tell only the things where you have to focus. That is how you study means it is enough. Hope you guys, your seniors are there. They have written community health nursing first. Whatever the concept we have discussed in our class, that only came. Okay.
Next. So this is the important things in the unit number 2, that is assessment and planning. You should focus, give a focus more on the curriculum development, stages of curriculum development. Okay. Next, unit number 3, it is implementation. So in the implementation, you will be studying about the classroom communication. Okay, so here in the classroom communication, what are the principles of classroom communication? Then what are the barriers of classroom communication? Then information communication technology, ICT. Okay, they will be asking like what is ICT or expand ICT. It is information communication technology. So this also you should study, information communication technology. Then classroom learning or the classroom communication. So it's a communication between the teacher and student. That is also you should study, principles and barriers of classroom learning, classroom communication or classroom learning. Next, so in this we can expect 15 marks or the 5 marks questions, which is method of teaching. Okay, this is very important. In the year base, like they used to ask the communication or the classroom communication, then methods of teaching. So this is very important. They will be asking like list on the methods of teaching. So in that any one method they will be specifying and ask the question to expand this particular teaching method. So this unit is very important. You have to give a more concentration towards this unit. So what are those methods of teaching, in the sense, like for example in the daily basis what methods we will use? Like for example we will be using the skill labs or the lecture method, demonstration method, discussion method or group discussion method, seminar, symposium or the simulations. So what are the methods we'll be using? Like self-directed learning, computer assisted learning, then one-to-one instruction, then team-based learning, problem-based learning, case study analysis, then journaling, debate, then gaming, interprofession education. So all those method of teaching, it is very important. So in this any one method they will be asked. Okay, they may ask. Then you have to study about the field trip, then museums, and role play project. So all this you have to study, like panel discussion, workshop, seminar, exhibitions, demonstration, redemonstration, micro teaching. This is also very important. You have to study this. Okay, all those methods of teaching, it's very, very important. We
This
cannot
micro
expect
teaching.
that this one only they will ask, but we can say the more expected is demonstration, panel discussion,
Micro
seminar, micro teaching, lecture method. Okay, they can ask this. And one more is problem based and computer based learning. This is also very important. And this that's all about the unit number 3, that is implementation. Next, unit number 4, teaching in clinical settings. Now we what we discussed, that is in the classroom setting, means it is between the teacher and the learner. So when it comes to the fourth unit, it is in the clinical setting. Okay, it's between the nurse and the patients, or between the clinical instructor and the nursing students.
1 second. How much mark? How much was community prediction mark, ma'am? So almost 10 marks question and
What
5
what we
marks.
said, the 15 marks question, it was came. Then even those 2 marks what we said, that is also we
Yeah.
got it. You
And
can't believe that
short essay
we
also.
told the same question which is in the 15 marks.
Yeah, same
Short
questions.
essay, short answers, we got it. You can check through our previous videos, you will comes to know.
Yeah.
Next,
And people are telling that something else, that you got paper. No, it is a complete predictions. Okay, so where how we were studied in
Yes.
our time, that is
Ah.
how we have predicted. No, the same formula we are predicting. Okay, so this time they can ask this one. Okay, so it is not any kind of loopholes here. So we are purely
Just
pure, genuinely we
our
are predicting.
assumption,
Yeah.
it's our hypothesis, we will expect this, because when we used to study, we do this, like from this unit what is the important things. We used to study all the syllabus, but in that we have to give more concentration on what topic, that you should have an idea.
Yeah, that only we
Okay.
are doing.
Next, unit number 4, teaching in the clinical settings. So in this clinical settings, I was telling that it's a communication between the instructor, clinical instructor, and the nursing student or the student nurses. Okay, so here what and all teaching method we will be using, that is also very important in this. So it's in this, what is clinical learning, that is important. Define clinical learning and the factors influencing in the selection of clinical learning experience. It's nothing but which teaching method we should use based on the situation. So based on that situation, what factors will be influencing to select you the important teaching methods during a clinical settings or in the clinical areas. When you are providing a health education or any kind of teaching in the clinical settings, what factors is influencing you to take a particular topic, we will tell that what are those teaching methods which we'll use in the clinical settings. That is very important, so note it down. So the first one is patient assignment. Okay, patient assignment is very important. Then clinical conference, patient assignment, clinical conference, clinical presentation, bedside clinic, or we will call it as bedside teaching. Okay, bedside clinic or the bedside teaching. Then case study or care study. Case study or case study is important. Nursing rounds, this you already know this. Nursing rounds, it's the easiest topic. Then concept mapping, evidence based learning, it is very, very important thing again. Evidence based learning. Then debate, game, project, or the role play. Then questioning, written assignment. Then process recording was also, it's very important. All these methods of teaching or the strategies you should study from this unit. Teaching in the clinical settings means in the clinical settings what methods we will be using. Like for example, nursing rounds we will use, evidence based practice we will use, role play we can give, then case study we can use, clinical presentations we can use, then patient assignments, written assignments, questioning techniques. So these are the methods which we'll be using in the clinical settings. Okay, these are the important topics. Next, fifth one, educational or teaching media. Educational or teaching media, unit number 5. Educational or teaching media, this is also very, very important unit. 15 marks they last from this unit. what is the important thing in this unit means you'll be completely studying about the teaching medias. Now what we discussed, that is methods are different, media is different. Don't get confusion between this. Sometimes they'll be asking like list on the teaching medias. Instead of listing out those medias, you'll be writing a methods. So be careful with that. So you have to specify the methods are different. Okay, media is different. So in the media it's nothing but you will be using only the aviates. There are a lot of types in that aviates, but the main thing is what? Audio visual aids. That is what we call it as AV aids. Okay, teaching media. So what is the purpose of this, components of this, principles and steps of media use, that you should study. Then when it comes to the types of media, so we'll be studying about the aviates. In that, projected aviates is there, non-projected aviates there, audio aids, then visual aids. There are four types. We can see the classification of this media use or the aviates classification. So in that we'll be getting projected, non-projected, audio aids, video aids. Okay, so in this, the projected in the sense like graphs, chart, then drawing, diagrams, postures, usage of the chalk board or the green board, smart board, bulletin board, panel board. Okay, so all this will be included in this non-projected. Okay, when it comes to the projected, film strips we can use microscope, PowerPoint, okay, PPT, then OHP, overhead projector is also important thing. You should know what are the projected aids and non-projected aids. Okay, projected film strips we will use, microscope we will use, then this overhead projectors we will use, or the powerpoints, PPT we will be using. This PPT slide, PowerPoint slides we will be using. That is what we call it as projected aids. Then moving visuals or the video visuals, so in that we'll be getting video tapes, DVDs we will use, or CDs, what we call CD, then Blu-rays or the flash drives we will use. So these are the video aids. Then in this, the very important thing is when it comes to the audio. Okay, audio tapes, radio or the tape record, what we call. Then digital audios, public address system, it's very important, public address system. Okay, then electronic media, when it comes to the electronic computerized learning, so we will be using the internet, laptop, tabs or the computer, e-learning, smart classroom, then web based video conferencing. So these are the important topics you have to study in this. Video conferencing or the telehealth you have to study, 2 marks sometimes they'll be asking. Telenursing or the telehealth. Okay, what is this telehealth? In the sense like they'll be getting a consultation through online for their like kind of symptoms or the disease, based on their condition. They'll be consulting the online, taking a online consultation through using those medias like internet or the any kind of search engines. So by using that they are getting a consultation. Okay, the patients are getting consultation from the doctors. That is what we call it as telehealth. Then what is the use of telehealth, advantages and disadvantages of telehealth or telenursing, you should study. So in this completely the whole aviates you have to study. What is aviates, what are the types of aviates, principles of aviates, then preparation of aviates. This is very very important, you have to see. Then you should have a clarification that what are non-projected, projected, audio and video aids. So in that all the topics whatever you are getting, you should write the preparation of that particular aviate. Then advantages and disadvantages is very important, you should add to all those method of or medias. Okay, next, unit number 6, that is assessment or evaluation method. Assessment or evaluation methods or strategy Okay, so here in this all those unit you have studied that how the teacher will be giving education to the student, or how the clinical instructor will be giving education. For that what the preparation they'll be doing, and Next is what methods they will use and what media they will use. So all those things you have learned. Then at last you have to evaluate the effectiveness of your learning. That is what evaluation methods. To evaluate what methods we will use, that is a simple thing. Okay, like for example, conducting annual examinations. Now you are writing your annual 6th semester examination. So through this we will be assessing your knowledge. Okay, so this is what you will be studying in this particular unit. So what is the important thing in the sense? Take down. You have to note it down. It's very important. Assessment method definition or evaluation method. Okay, you can take it as evaluation method definition, scope, principle, scope, and selection. Selection is very important. Selection of assessment methods. Then barriers barriers. Okay, so this is what the basic things you have to study in this unit. So when it comes to the important, we'll be discussing about assessment of knowledge, assessment of skills, assessment of attitude. Based on this three types only, all those methods of evaluation will be classified. Okay, so first we will discuss about the assessment of knowledge. So by using these tools or method, we'll be only assessing your knowledge. Okay, so what are those in the sense, like for example, giving essay type questions or short essay type questions or long essay type questions or short answers will be asking or MCQs. This is very very important. The preparation of this MCQs or the essay questions, what are the preparations has to be done, selection of those questions, then what are the important steps has to be used before developing those questions. It's very important. Advantages and disadvantages.
In the meanwhile, here we have to go with this assessment skills also.
Assessment skills.
Clinical evaluation. Okay, suppose we are giving
Observation, checklist we will use. Then rating scales we
Scales
will
will
use. Or now you already know this. This is very familiar to you all now. OSCE method.
Yeah, we used to conduct
Objective structured clinical examination. Okay, this is very important. This is what assessment of skills. By conducting, by using some tool, we are assessing your skills. Okay, there are difference. Knowledge assessment is different, skill assessment is different, attitude assessment is different. Hope you already studied this. So you have to keep it in your mind when they ask specifically ask assessment tools to assess the knowledge.
Yes.
Or evaluation tools to assess the knowledge, or evaluation tools to assess the skills, or to assess attitude. So you have to be specified with that. And then when it comes to assessment of skills, you have to study about the nursing care plans, process recording, written assignments. This you already studied in 4th unit. Okay, then verbal communication, simulation, objective structured clinical examination you have to study. Next, self evaluation. Okay, then clinical logbooks, clinical portfolios, every will be studied. Next, assessment of attitude. So in that assessment of attitude, definitely they will be using a attitude scales. Okay, like for example, interruptive questioning, hotpots question, then drag and drop, then order response question. So this and all you already studied. It's just a basic things you have to study this also. Sometimes they'll be asking in the multiple choice question or in the 2 marks
questions.
Okay, this unit also it's very very important. You should keep it in your mind. Give a more concentration about this
particular
skills and knowledge.
Yeah.
Okay, sometimes they'll ask this attitude also. We cannot predict that. Next, unit number 7. It's guidance and counseling.
Guidance.
This is the very very basic. Since from first year you're studying, it's very important also. Okay, first you study about the guidance, definition, purpose, principles of guidance, objectives of guidance, then scope of guidance. Then what is the role of teacher or academic advisor we will call. Okay, academic advisor or the faculty in the guidance. Okay, when you are providing a guidance or any kind of suggestions to the students, to the learners, what's your role? That is very important. You should study that. Then counseling. So already know that counseling is a interaction between the counselor and counselee. You should keep it in your mind that who is the counselor, who is the counselee is very important. One who is giving a counseling, that is counselor. One who is seeking for a counseling, that is counseling. Okay, counsel is different, counselor is different. One who is providing is counselor. One who is taking or one who is seeking for counseling is a counselee. That you should know a difference between those two words. It's important. Then what are the objectives? Same definition, scope, principles, and process or steps of counseling is very important. Like they'll be starting with the introductory phase, orientation phase, working phase. Then it's a induction. The first one is induction or the introductory phase. They'll start, and last is a evaluation phase. So that you should learn. Then counseling skills and techniques is very important. What are the techniques of counseling? Active listening, paraphrasing, all those techniques or the strategies you should study. Then what is the role of counselor? Being a counselor, how they should have some skills or the strategies, what's their role? That is also very important. Next, they'll ask difference between guidance and counseling. Okay, that is also expected question. Next, the last unit is ethics and evidence based teaching. This is also very important unit or the topic. Okay, evidence based teaching, ethics and evidence based teaching in nursing education. In nursing education. So in this you should give a review about the ethics of nursing. Okay, that you already know since from first year nursing foundation you are studying about the ethics, code of ethics of our nursing. Okay, then what is value based nursing, or what is evidence based nursing, ethical decision making means what, informed consent means what. So all those you have to study. How the student and faculty relationship should be. In the nursing foundation you have studied how the nurse and patient relationship. So in this education you will be studying how the student and faculty relationship. Okay, how the student and teacher relationship should be,
interpersonal relationship,
that
exactly.
you should study. Then what is the process? Explain the process of evidence based teaching. That is very important. You have to study this evidence based teaching. So that's all about the CT or educational technology unit revision. So hope you will be understanding what we are explaining. It's just a quick review. You already studied that. For your revision purpose, we just give a review of this whole syllabus. Now
it's important questions.
Take down important questions from whole syllabus. Okay, from the whole syllabus we are telling the long essay questions. The long essay questions. Take down. First thing is define educational technology. Define educational technology. Explain its scope, objectives and importance in nursing education. Next, explain principle, methods and barriers of effective communication. This is very important question. Okay, then communication process with the diagram. Like sender, receiver, message, media, feedback, that you should explain with the diagram, and barriers are very important. Next, discuss the teaching learning process. Explain the principles affecting learning. Okay, or the factors, we can call factors or the principles which is affecting learning. Then next is explain the lesson plan, definition, then principles, format of writing a lesson plan. This is very familiar for you guys. Then describe aviates, classification, principle of selection, uses, advantages and limitations. Disadvantages also is same, limitation is also same. Next, explain micro teaching and simulation in nursing education. Okay, this is also very important. Then describe teaching method, list down the methods of teaching. Then in that they can ask lecture, demonstration, discussion, seminar, symposium, workshop, role play, panel discussion and field trip. Okay, Next, discuss evaluation in nursing education. Explain the types, principles, and tools of evaluation. Now, what we explained, okay, that unit number 7, it's very important. What are the tools of evaluation? There are 3: assessment of knowledge, skills, and attitude. Okay, in that subtypes you have to explain essay type, short essay, MCQs. Then when it comes to skills, skill labs or the OSCE, that you have to explain assignment, patient assignments, then written assignments,
Case
nursing
study.
routes, case study, clinical presentations, then aptitude and the attitude test you have to say, then hotspots questions, drag and drop. So all those you have to study. Next, short essay. In that, characteristics of effective communication, types of communication is important, interpersonal communication, then therapeutic communication, communication barriers, feedback in communication, that is also very important. Then principles of teaching, then maximums of teaching is important, that is I forgot to tell you, maxims of teaching. Okay, then domain of learning, domains of learning, in that we can see only the 3 domains: cognitive, affective, and psychomotor. Okay, cognitive, affective, and psychomotor. This is also very important. Domains of learning. This is what we call 3 domains of learning, that is cognitive, affective, and psychomotor. Next, aviates, in that they can ask charts, flashcards, or posters. Graph, they can ask the different types of graphs. Okay, then LCD projector or the PowerPoint projection or the presentation, group discussion, seminar, symposium, panel discussion, workshop, role play, demonstration, bedside clinic, evaluation methods. This is very important. Then ASCII. Next, list the characteristics of a good teacher, then list the types of aviates. Then the very important thing is you have to focus on the communication, principles and maxims of teaching, lesson plan, audiovisual aids, teaching methods, teaching media, evaluation, tools and methods. Then nurse educator, what is the role of nurse educator?
Qualities,
And
characteristics,
qualities or
everything you have to
characteristics.
focus.
Yes.
Whatever you learn, okay, so in that also nursing educator part
Role
will
you
come,
have
role
to
will be come,
write.
okay, so that you have to mention it after the end of your answer. So this is all about the CET. Okay, hope you guys are understood the where you have to focus more, what are the important things you have to focus, and whatever the questions you have left from apart from this particular what we have told, no, that topics, if you left means kindly go through those things. Okay, so it
Give
is
a
very
revision of
easy.
that.
Yeah, and this
It's easy
micro
subject.
teaching and all you should not miss and go. Okay, so because those are the very important, even it is a dry topics, so it is one of the interesting. Only
Yes.
this philosophy and all
When
which will be
you
dry.
are going to understand the concept instead of doing mug up
Mug up
and
and
all,
all.
you just understand the concept and go. It's easy for you. For you, it is very easy to write down. Okay, just understand. See, you'll be know that what is lecture method. Taking a classroom lecture, what we are doing now, this what we call it as lecture method.
Yeah,
But the thing is,
discussion.
you should use a textbook words. That's
Yeah.
all. Don't mug up all those like what is in the book.
Lecture
Like,
method is a lecture method is a lecture method.
don't do
use
like that. So just understand what is this concept. Then you can write all those answer. Then for each all those methods or tools, whatever they ask, you have to write advantages and disadvantages. Okay, then preparation is important. Preparation, advantages, disadvantages. This is commonly you can write to all the methods or medias or tools. You can write down. Okay, hope this video will be very useful for your tomorrow's exam. So all the best for you. Thank you.